Good morning, everyone. My name is Su-Ling Ching, and it is my honor to be the President and CEO of the Ottawa Board of Trade. Welcome to our late-breaking webinar, Stay Safe, Stay Open. We come to you virtually from our beautiful National Capital Region in the city of Ottawa. Ottawa is built on unceded Algonquin and Anishinaabe territory. The peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia. Their culture and presence have nurtured and continue to nurture this land. The Ottawa Board of Trade honors the peoples in the land of the Algonquin and Anishinaabe Nation. The Ottawa Board of Trade honors all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. As all of you know, we are an independent, nonpartisan, not-for-profit business organization. We are the voice of business and a key advocate for economic growth in our nation's capital with a mission to cultivate a thriving, world-class business community. And to that end, we've been advocating for programs and policies, as well as providing information and assets to help businesses stay open safely and promote consumer and employee confidence. To date, we have provided over 137,000 rapid tests to local SMEs, worked with the City of Ottawa and Ottawa Tourism and our colleagues across Canada to increase consumer and employee confidence with the Post Promise. And finally, we encourage everyone to support the local economy through these times with our Buy Local Ottawa campaign, Put Your Money Where Your Heart Is. In light of the rising cases and the unknown impact of the new variant and the potential burden on our healthcare system, we wanted to create an opportunity for you to hear directly from key experts in our community about what is happening and what we all need to do about it. A quick review of today's agenda. We have a presentation by Dr. Vera Etches from Ottawa Public Health, Dr. Kumaman Wilson from Can Immunize, Alicia St. Hill from Can Immunize, and Colleen Flood from Ottawa University. Time permitting, we will open up for a Q&A session as well. So let's get started. First, Dr. Etches was appointed as the Medical Officer of Health for Ottawa Public Health in April of 2018. Having served as the Deputy Medical Officer of Health from 2014 to 2017, she supported the organization in delivering quality, client-centered services, contributed to knowledge transfer and applied public health research, and reinforced population health assessment, surveillance, and program evaluation. I would like to take this opportunity to thank Dr. Etches for her steadfast collaboration and leadership during these challenging times. You have really been a pillar of strength for our community, and we were so pleased to recognize you as the Newsmaker of the Year for 2021. I hope that you're not the Newsmaker of the Year for 2022, but we appreciate you making time to be with us here today. So I'll turn it over to you, Dr. Etches.
Well, thank you, Su-Ling. Thank you to everyone working with the Ottawa Board of Trade and all who have joined in today. It is impressive how dedicated you are to being able to operate in a way that protects people, adaptations that you've made over time. I'm so thankful. I certainly see you as partners in supporting the health of our population, and I really welcome the opportunity to have ongoing dialogue. I think probably the main thing, like the chief message I would like people to take away today may not be sinking in everywhere because it's so new. So the main message I have is that Omicron is changing things again. It is a significant challenge ahead for us because of Omicron. It's different. I have more information even than I did last week about what the scientists are predicting, and I think it's just starting to come through. Public Health Ontario is our scientific advisory body for our work, and they've just produced a report that's up to date. It does show that the Omicron is pretty much it's the majority of COVID in our communities now. Will be pretty much all the COVID within a week or so. And it it is being passed on. It's more transmissible. It's showing, 7 times the transmissibility. In Ontario, in the period they studied, we'll get final assessments, in different contexts, but it's much more transmissible. So creating more people testing positive for every one person who tests positive. And this is changing things in terms of how we have to handle COVID in our community again. As public health, we've let people know that unless they're in a high risk setting, like a healthcare or a congregate setting where people are older, schools, we are having to rely on people notifying their contacts. And the other thing that's coming through is that this kind of growth will lead us into a place that's hard to handle. And that hasn't maybe been as clear in the media because people have been talking about Omicron being less severe and maybe we'll just sweep through and we'll all be okay. And I don't think that's what the scientists are concluding now. We can imagine that even if it's less severe, which it may not be in our population where we have an older population and less previous infection from COVID, it's not clear it would be less severe, but even if it was, just the sheer numbers of people testing positive, small fraction of those having severe illness would be quite a lot to handle for our system. So a couple more things about Omicron. It's that our 2-dose of vaccine doesn't seem to be as effective. So people are getting infected with symptoms from Omicron when they have 2 doses of vaccine and they are passing it on. It's not useless. Vaccination is still helpful. It's still going to protect people from severe illness. And that's important. I'm quite concerned for unvaccinated populations where they're older adults. And our government has been announcing how they're going to try to keep working to protect long-term care and more vulnerable populations, older adults. So this leads me to, what is a big focus right now is the vaccination campaign, where that 3rd dose is an important added protection. It appears to bring, as protection back up. And so the government, and I agree with this, is prioritizing people over 50 because they're most likely to be hospitalized or have severe illness. And in Ottawa, we have 283,000 people over 50 who haven't had a booster dose, right? It's a lot of people that need that. And so demand is high. Last week, we were giving 3,000 doses a day in our clinics. Pharmacies also help and a few family doctors. But that's not going to make a big dent in that population. That we were focusing on children 5 to 11. So this week we are already ramped up to about 5,000 a day. We're planning to try to get to 10,000 by the end of the week. Many partners helping, but everyone who comes forward to immunize is leaving probably other essential work, and it's still not going to turn the curve. Right, that kind of booster protection is to protect people from hospitalization and death, but it won't change things, in terms of how Omicron grows in our community. So the government is also, considering what other measures prevent transmission. And here, what you're doing matters. It does. When people wear their masks well, when there's distancing between people, these things help slow down transmission. I think that it's likely we have to do more in terms of capacity limits, just helping people have fewer contacts between each other. And so I'm hearing the government's moving on this quickly. This is something that's best accomplished at the provincial level, but I will have to keep talking to our community if things aren't protecting enough. So I know this has implications for businesses and how you operate, and so I'm happy to take questions later. I'm really thankful for the other kinds of ideas that will be discussed today about ways to protect businesses and employees.
Thank you, Dr. Etches. At this point, I would like to introduce Dr. Kumaman Wilson, the CEO of Can Immunize. He is an internal medicine physician, scientist, and expert in digital health. Dr. Wilson is an internationally widely published expert in public health and immunization and the founder and CEO of Can Immunize. Dr. Wilson's vision is to use technology to solve public health problems. I'll turn it over to you, Dr. Wilson. We can't hear you, Dr. Wilson.
Sorry, thank you, Su-Ling. And I think this will follow nicely from Dr. Etch's comments. As Dr. Etch has mentioned, there's still a lot of uncertainty around the pandemic. I'd like to begin with this graph. So this was the good news from the mRNA vaccines that when they were the initial study showing 95% effectiveness. And we really did need this remarkable accomplishment. In a rapid period of time, we produced safe and effective vaccines. But obviously things are changing. And as Dr. Etch mentioned, the virus is progressively becoming more infectious. And the effectiveness of the vaccination is now different. So the vaccine was actually initially designed to protect against serious illness, as we call protective immunity. We had a bonus result initially. It also protected against infectivity. So this is what we call sterilizing immunity. This is now changing, and we're seeing less protection against infection, but it still does appear to be maintaining good protection against serious illness. So the vaccinated are now getting breakthrough infections and can be infectious, but they are still protected against serious illness, particularly in younger populations. And we saw this with Delta. So after Delta became the most common variant, those that were vaccinated had a 5 times reduced risk of infection, but in particular, they had a much greater reduction in hospitalization and deaths. So vaccination is incredibly effective in protecting against serious illness. So how does vaccination reduce the spread of the virus? You've likely heard a lot about this idea of a basic reproduction number. That's the number of individuals who are infected for every infected individual. And we want to have that number less than 1. If we're over 1, we're in exponential growth. And there are 2 ways we can reduce that reproduction number with vaccination. One is increase the number of people vaccinated, and we're constantly working towards that. But the other is to improve the vaccine effectiveness. And this is where the idea of boosters comes in. So let's start by looking at how improving vaccine coverage can reduce infection. With the Delta virus, the thought was that the basic reproduction number was around 5. So 5 people would get infected for every 1 infected. And we know with Omicron, it's going to be much higher from what we've seen so far. Let's assume that the mean vaccine effectiveness is about 80% with some due to waning immunity. With 70% vaccine coverage, we can reduce that basic reproduction number to 2.2, but that's still exponential growth. But if we could get 100% vaccinated, we can reduce that to 1 and end exponential growth. But vaccination is not the only thing that reduces the reproduction number and the spread of the virus. And it's really important to recognize this. It's not a panacea. And we know masking can reduce that by maybe up to 40%. And ventilation and filtration systems, even opening your window a little bit and then allowing air to go through can help reduce the spread of the virus. But we now have a new challenge, a waning immunity. And these vaccines were necessarily developed very quickly and they were identified to be safe and effective, but they didn't really have a chance to determine how long they would last. And now we're seeing about 6 months post-second dose, the risk of infectivity is going up. For Delta, we still saw they were maintaining pretty good protection against severe illness, but we were starting to see more breakthrough infections. And this has resulted in changing requirements on who should receive boosters. And the question that's now arising is, do the boosters also improve protection against variants? And we're seeing some preliminary data to suggest that, but we do need to have more data on that. So how can boosters reduce infection? So let's say the basic reproduction number is 5. And because of waning immunity, let's say the mean vaccine effectiveness is now 70%. And even if 100% are covered, we're still going to be in exponential growth. So it's a reproduction number of 1.5. But let's say with boosters, we can push effectiveness up to 90%. We can then reduce that effective reproduction number to less than 1, to 0.5, and we can get out of exponential growth. So these are our two tools on the vaccine side. We need to increase the number of people vaccinated, and we need to ensure people get their boosters to help reduce the likelihood of spread. So what does this mean for the workplace? Workplaces are going to need even stronger vaccination policies. And the number one reason is to protect not only the unvaccinated, but the suboptimally vaccinated. And these are people who are 6 months post-second dose. And these individuals are at risk if they come into indoor environments where the virus is circulating. Vaccine policies can increase vaccination rates. Boosters can improve vaccine effectiveness. And overall, this will provide added protection to the workplace. So what should workplaces do? I think we're going to get some guidance, but consider other options to full return to office will be important. Mandatory verified vaccine status reporting policies. So you need to know, it can't just be an attestation. I don't believe at this point, you need to know, if they've actually received the vaccines. And then workplaces can help public health by identifying suboptimally vaccinated individuals, notify them to stay home if cases are circulating, and importantly, reach out to those that need boosters and help them facilitate receiving the boosters. As we know, this will be a real logistical challenge, and anything we all can do to help with that will help us get through this. Other things workplaces can do, continue masking indoors, strongly consider ventilation systems, HEPA filters, and follow the guidance and use of rapid antigen testing systems, which are very good at identifying individuals who are infectious. And this is something we're working on, which will lead into the next presentation, is that we're working on identifying where in a workplace may be a particular risk based on what we know about waning immunity, and then helping businesses identify who needs those boosters in advance of outbreaks happening. Thanks. I'll pass it back to you, Suling.
Thank you, Dr. Wilson. I have questions for both of you, but we'll wait till the end. I appreciate your presentation. I'd now like to introduce Alicia St. Hill, who is the Vice President of Business Development at Can Immunize. Alicia brings 15 plus years of experience, both in Canada and the US, in health information technology, healthcare operations, and program development. Before joining Can Immunize, she led significant components of COVID-19 policy for Kaiser Permanente, one of the largest healthcare maintenance organizations in the US. She has worked at Health Canada in health system operations and strategy from within large hospital systems. Welcome, Alicia.
Thank you so much for having me.
Mm-hmm.
So thanks, Sulin. As I mentioned, we're joining you here from Can Immunize, and just a little bit about our organization. We're an Ottawa-based company with over 10 years in the digital vaccine technology space. Some of you may even have the Can Immunize public app tracking your COVID-19 vaccines on your smartphone right now. And that has given us a lot of credibility in the space. We continue to support Canadian vaccination best practice here, and by developing and supporting technology and interoperability of vaccination tracking, which is why when the pandemic really started to hit and we had this COVID-19 vaccine that we needed to get out and quickly, we were tapped by a few provinces to support their operations in managing that mass vaccination. And until this date, we are now continuing to support those provinces as they are scheduling people for booster doses and issuing proof of vaccination certificates to millions of Canadians through our technology. From that, we've learned a lot about privacy and security, and using industry-leading security practices and privacy policies and consent statements that really help organizations make sure that they're adhering to privacy regulations from across the country. Which brings us to, what we're talking about today and why we are experts in this space. Now that we've considered and know that there's such an important value in businesses encouraging vaccination among their staff and managing that risk, both for keeping operations open and a duty to protect employees, what technology do we actually need, and how does it need to support these vaccination policies we're putting in place in the workplace? So I'll share a few insights from what we've learned from the organizations we've worked with, big and small, this year. First and foremost, the technology really has to be customizable and flexible. As we discussed this morning, these policies are changing. Booster doses are coming. We're no longer capturing 2 doses, but 3. And certainly knowing that there's 6 months after the second dose, or knowing how long it's been since your last dose, will be important information in helping you adhere to a vaccination policy within the workplace. We even think that eligibility for vaccination policies are different between teams. You may have remote teams and in-person workplaces, and depending on the case examples within your organization, those policies will vary over time. And so technology needs to support you as your policies change and as the environment around us is changing. Capturing vaccination doses and exemptions is also something that technology should also support for the small minority of people who have a true medical exemption from vaccination. We also understand that personal health information is paramount. And many organizations are telling us they want to know that the data residency is staying within Canada, and it's important that they collect consent and share a privacy statement with their employees as they're collecting that information. We also believe it's important to support secure communication, bidirectional communication with staff. That keeps information about vaccination doses out of email, for example, but secured behind encrypted platforms like our Immunize Shield solution that I'll tell you about in a bit. And certainly making sure that the personal health information that is shared is kept only in front of those who need to know it, and really reduces the risk of the information being shared with those inappropriately. So making sure there's role-based permissions based on different roles that keep vaccination status with the management team, or per the policy, who needs to enforce that policy within your organization. These tools would be nothing without their useful insights as well, offering real-time information back to those who are enforcing policy and monitoring these policies, whether they're mandatory or voluntary. And certainly the technology should help you as an organization understand who's overdue for vaccination and who has an upcoming dose. That bidirectionality of the technology solution can also help you identify those who need a dose reminder in a secure and private way. And lastly, we truly believe that record verification and being able to capture the actual proof of vaccination certificate within your technology provides the confidence that you need to know that people are in fact covered within your workplace. I know many started with surveys and attestations, but we're hearing more and more of organizations moving towards wanting to capture that proof of vaccination as a better source of information, and having tools that make it easy to review what is submitted to your organization. So enter in Immunize Shield. Our solution offers encrypted bidirectional portals that allow vaccination records to be captured and exemptions to be captured from employees, but also allow you to head messages back to those who may be delayed in their submissions of vaccines or have upcoming doses. Real-time verification using a rule engine, but also human verification if necessary. It's a privacy compliant model, capturing consent from employees and making sure that there are role-based permissions limiting access to information. And our smart vaccination status. This is our answer to what is changing and evolving every day. What was defined as fully vaccinated in September may not be what's defined as fully vaccinated in March. And solutions should be able to respond to that, which our solution does. So to start off, most organizations will want to have technology that can be used from any platform. So Immunize Shield is accessible from any smartphone, tablet, or desktop. And employees can be invited if they have in the email is known or using a shared single sign-on solution. Or to support those for whom email is not known, there's also registration options that allow you to share a web portal link and have those for whom email is not known log in and share their information. Within just days, most organizations are up and running and sharing those invitations and capturing that and seeing their campaigns grow and knowing their protection levels are improving. The smart status component of our technology is central. It is the way of being able to indicate what's the protection level of compliance that each individual staff member has. And as the pandemic evolves and we move to 3 doses potentially being a requirement, then that definition of fully vaccinated and partially vaccinated needs to change. It also may need to change between teams in your organizations. We think about companies where they serve long-term care in part, and perhaps different sectors in others, and they may have various policy differences between their teams. In addition, you'll notice on screen that we allow organizations to also capture those who are exempted, and if those exemptions have been approved or denied by those who are enforcing the COVID-19 policies in the organization. Coming soon to our tool, we'll be integrating these same smart statuses into rapid antigen testing protocols. So where your policy has a requirement for antigen testing for those who are less than fully vaccinated per your policy, these tools will help you remind those individuals to submit their testing on time. Lastly, is the verification requirement. So with proof of vaccination comes that benefit of being able to verify that those vaccine doses are in fact the right distance of time apart, that it's been 14 days since the second dose, or other requirements along the lines of what it means to be fully vaccinated are verified as the records are being uploaded. So that's that real-time verification. As the publishers of the Canadian Vaccine Catalog, we can also allow an additional layer of review of authenticity by comparing the lot numbers that are submitted with those that have been distributed in Canada, giving you additional indication that you've been provided with authentic proof. Hard check verifications offer the organization to either manually, internally manage reviewing vaccination doses as they come in and looking at those proof of vaccination certificates themselves. Or should a company need that help, Can Immunize can support them with human verification services by our highly trained team located here in Canada. That allows them to provide a level of review that those proof of vaccination certificates that have been submitted are indeed authentic. Coming soon, given the fact that every province in the country and every territory now has a proof of vaccination certificate QR code, we are embedding QR code verification and data extraction right into the solution, offering you even another level of authenticity verification. So I hope I've shared a bit about how the technology can really help you validate and encourage vaccination and monitor that risk to your workplace. I hope you've been able to consider just how you'll be able to leverage technology as it prevents workplace outbreaks before they even start and support increasing the vaccination coverage of our community. Thanks, Elaine.
Thank you very much, Alicia. And now I'd like to introduce Colleen Flood, who is a professor and university research chair at the University of Ottawa. She's an inaugural director of the University of Ottawa Center for Health Law, Policy and Ethics. From 2006 to 2011, she served as scientific director at the Canadian Institute for Health Services and Policy Research. And from 2000 to 2015, she was a professor and Canada Research Chair at the Faculty of Law, University of Toronto, with cross appointments to the School of Public Policy and the Institute of Health Policy Management and Evaluation. Colleen, I could barely say it. How did you do it? All of that. I think you're on mute.
Pardon me, sorry about that.
You are.
I was thinking how inept Kermanen was with technology, and then I went and replicated it. Sorry about that. I also would like to introduce my colleague, Brian Thomas, who's on the line, who is a senior research associate with the Centre and expert in law and religion with more degrees than most people have hot dinners. So thanks to Brian for working with us on this topic. And also our colleague, Vivek Krishnamurthy, who isn't here today, but he is a professor at the University of Ottawa and an expert in privacy law. So he's been helping us with some of that, some of this work, I should say. And of course, thanks to Kuminen, who we've enjoyed a really interesting dialogue about law and innovation and vaccine passports and mandates over the last year and a half or 2 years coming up horribly. So thank you very much, Kuminen, for your work. And thanks to Vera for everything you're doing. We're just also grateful. So, you know, talking about law, you know, you often feel a bit like the skunk at the picnic, and I'm sorry for that. But, you know, if we can help to add some clarity to what is often, I think, very confusing for everybody, then hopefully it's worthwhile to tune in. So you're seeing that governments have mandated vaccinations in many contexts, but not in some and not others. Required proof of vaccination more generally, but in non-essential settings, primarily like restaurants and movie theaters. But what's confusing for businesses is that the law governing businesses that are not covered by these measures, right? So you'll know that you have to do some things. So if you're a restaurant or non-essential service movie theaters, you have to require proof of vaccination from customers. But what about situations where the law doesn't speak to you? You know, what are your requirements then? And I think this has led to much confusion. Are you permitted to do anything? Are you permitted to require proof of vaccination, whether of your employees or of customers, where the government hasn't said anything about it, right? I think that's the basic source of the problem. And as we'll see, you know, I guess luckily enough, really, because we haven't lived through a pandemic in most of our lifetimes, the law isn't very clear on this because it hasn't had to deal with it before. And that's part of our problem. So we're a little bit fumbling around in the dark, trying to figure out from the extant law, case law in particular, and law from labor law from arbitration rulings, both that are happening now and that have happened in the past, how courts and labor arbitrators are likely to respond to different efforts by businesses to try to stem the ill effects of COVID-19. So the question then that businesses might be asked, you know, are we allowed to do X or Y or Z under the law? And really, probably the better question, the way to think about it, is there anything in the law preventing me from doing X or Y or Z? So that's to flip it around, which leads to this sort of gap, right? That's where the trouble comes in, because there's nothing so far really emboldening you or underscore your efforts. But as long as the law doesn't prevent you from doing it, then you are permitted to do it as a private entity and not a government actor. So there are really three areas of law that might impact your ability to do X or Y or Z. And we'll group these as human rights law, privacy law, and employment law. And we'll do a whistle-stop tour of each of these areas. So first on on human rights law, the private sector is subject to provincial human rights laws, which prohibit discrimination under several headings. And most importantly for us, they prevent discrimination on the grounds of disability or discrimination in Ontario on the basis of creed. So first on disability, there's a very small subset of the population, and Vera, I'm sure, has spoken of this before, who can't be vaccinated due to allergies and a failure to accommodate those people to the point of undue hardship will qualify as discriminatory under human rights laws. So you do need to make provision for people who genuinely can't be vaccinated. But what's less clear is what is the standard of proof required by those claiming medical exemptions. Traditionally, human rights tribunals have told businesses to take people's word for it. We suspect that tribunals, though, will not take issue with private sector organizations demanding at least a doctor's note in the case of COVID vaccinations. That's because, unlike, for example, a physical disability, the fact that you're not vaccinated could harm others, pose risks to others, and not only to yourself. And of course, you know, the reason why we want people to be vaccinated in part is so not to overwhelm our healthcare system. So in the past, I think there's been a concern about people galloping in requesting doctor's notes, but here, you know, we're trying to stop the healthcare system being overwhelmed. So we think it's probably likely that human rights tribunals would accept a requirement for at least a doctor's notes. Or now the other discrimination is on the basis of religion or conscience or creed, as in the Ontario human rights context. And no major religion has come out against COVID-19 vaccinations. So it's difficult, really, I think, to position this as a matter of religious faith. Non-religion or conscience-based, sorry, I need an extra coffee. Conscience-based opposition to vaccines, vaccine hesitancy. In our view of the existing law as it is, we don't think that's protected. The Supreme Court and human rights tribunals have explained that only really truly comprehensive value systems are protected from discrimination. So not particular beliefs, for example, about the safety and efficacy of vaccines. And we've seen cases in the past, for example, where an individual has argued that as a matter of conscience, they shouldn't have to wear safety belts, and courts have not upheld that. And the accommodation that would be required, for example, for someone on the grounds of disability, would be to a point of quote unquote undue hardship. And the test of undue hardship is contextual. It does turn on the risks posed by allowing an unvaccinated person into a specific workplace, given the proximity of other workers, ventilation, the vulnerability of people in the midst, the feasibility of alternative working arrangements, for example, working from home. So unfortunately, you know, one size doesn't fit all here. It will be context specific what amounts to undue hardship. So the next sort of set of laws that may prohibit or limit businesses' choices about what they do to control COVID-19 vis-a-vis their employees or customers are privacy laws. And I guess, you know, most of you are probably aware that Canadians' sort of mishmash of privacy laws across the country are incredibly complicated. You know, even for lawyers trying to understand Ontario's privacy laws would do your head in on a good day. Basically it's complicated, but in the case of Ontario, we do not have any specific privacy laws that speak to private businesses that are not federally regulated industries. So the federal regulation, PIPEDA, will cover federally regulated industries, for example, banks and so forth, but will not apply normally to private entities, private commercial entities. And thus privacy law is really governed more by what we call the common law. So this is, you know, law made by judges over time through case law. And so really then it comes down to the question of, for a private sector business inquiring about the vaccination status, be it of customers or employees, is there really a legitimate business need to collect this information about vaccination status? And again, this is context specific. It will depend on what is reasonable in all the circumstances. But of course, in the context that we think of an ongoing pandemic caused by highly transmissible airborne viruses, businesses where there are close proximity between customers, which is necessary for the provision of services, for example, personal care services, one would think they could make a strong case regarding the legitimacy of their need to verify vaccination status, for example. Okay, so on the homeward stretch, and probably the most complicated piece of all is employment law. So we have human rights law, we have privacy law, and then we have human rights law. Now, we know that under Ontario law, employees have an obligation to take reasonable steps to provide a safe workplace. So in a sense, here we have a piece of legislation that might give some cover, if you like, or legitimate more clearly actions by private corporations. But, the devil's in the detail. What is reasonable and what is reasonable is context specific and case by case. And we need to acknowledge, I think, as we've been hearing from the other presenters, it can be a full-time job. I think it's various full-time job to keep on top of the evidence, right? And this can be very difficult, I think, for employers one by one to be able to say at any particular time, what is reasonable, what's the evidence on safety, what's required in any particular circumstance. Now, employers have different obligations depending on whether the environment is unionized or not, obviously. And in an unionized environment, employees can only be fired with just cause. In non-unionized contexts, employees can be terminated without just cause. But if the termination is justified, then this can affect whether severance pay has to be offered or not. So the justification is relevant for both contexts. And then whether a refusal to get vaccinated is just cause is again contextual. It's going to turn on the risks posed in a given workplace, the exposure of vulnerable populations, the feasibility of accommodations like continued working from home. And so I think you've probably seen out in social media space, you've got employment lawyers very hot to trot on one side or the other of this topic. And so that too leads to confusion because you've got some saying, no way can you terminate, and others saying you can. We think it's quite unclear where the arbitration will come down on terminating or disciplining employees for refusing to provide proof of vaccination. The question is context specific to the workplace, and there's very little jurisprudence available to help guide us here. I think a case could be made for either, depending on the specificity of the employment context. And we hate to tell you that you probably need legal advice because we know that it's expensive, but in this sort of circumstance, you probably do if you're terminating somebody. So, I was trying to find a picture of layers and all I could find was this mattress, but it will do. Everyone realizes, I think, that what you need are layers of protection. And from a legal perspective too, layers, I think, and efforts to do everything you can short of requiring vaccination will also go to the reasonableness of your actions, right? So have you done everything you can before you get to perhaps the more, nuclear option from the perspective of someone who is has an anti-vax stance. So the first would be promoting vaccinations in the workplace. Second, providing time off work to employees to help them get vaccinated or their children to get vaccinated, and the boosters, etc. Helping transport employees to vaccination, even helping them register for vaccination if they have difficulty doing that. And let's face it, none of it is all that easy. assessing the risks. So because it's context specific, you really need to consider carefully what are the risks of COVID spread, given our particular circumstances, how close employees have to work together, the extant ventilation, whether or not it's possible to improve it, the risks to customers, and so on. In our view, layer in, N95 masks, HEPA filtration, and social distancing where possible. These are all things that are possible to do, but again, sometimes the filtration option might be very expensive depending on your circumstances. Consider requesting at least proof of vaccination from employees so you can warn them there is an outbreak and ask them to stay home. The people who aren't vaccinated are at the highest risk. So Kumanen makes this analogy of it's similar to asking people to wear hard hats on a construction site. They don't wear hard hats to help anybody else, except I guess the psychic harm of seeing someone really badly hurt. But this is to help protect them. And that kind of mandate has been upheld by the courts and by arbitrators. So one could think of it in that manner. You can consider I just jumped in there. You can consider layering in requirements for proof of vaccination in high risk settings or else repeated testing. But again, the testing doesn't actually protect the individual, him or herself. They can still become infected by vaccinated employees or customers. So you're not getting the hard hat kind of protection here. And last, but I think no means least, part of the problem here, I think, for business is there's just really a lack of clarity in the law, as I said, because we've had the good fortune to mostly never have had to live through our pandemic, at least in Canada. And what would be ideal is for government to provide clarity for employers about being able to require proof of vaccination from customers and employees, and what exceptions are or have to be made in that context. So I hope I haven't gone on too long. Here's a few more just emerging trends in employment law, and we will stop there. So thank you very much for your time, and I look forward to some Q&A if there's time.
Thank you so much, Colleen. That was fantastic. So Lynn, I'll turn it over to you. I think we have a couple of questions here in the Q&A.
We do. We have a couple of questions that have come in from our live audience, and I have a question that was emailed in to us as well. I believe the first question can be directed to Ottawa Public Health, and the question is, all of our employees are fully vaccinated, but work closely together in a warehouse environment. Should we introduce rapid testing as a screening tool?
Thanks. I was quite happy for Dr. Wilson to take this one as well. I do think that if rapid tests are available, they're another tool. That if you're asking people to test frequently, it needs to be frequently when there's and it makes sense to use them when COVID's high in our community. So we're entering into a period with a lot of COVID in our community. So using them at least twice a week, maybe 3 times a week at minimum, should help detect, COVID. With more transmissible variants, there still can be transmission before it's detected, but at least you're detecting it at some point compared to not. So there's a limited supply of rapid antigen tests. I know the government's working on this. They do have the ones through the Ottawa Board of Trade. So maybe Sue Ling would like to comment on your stockpile. We don't have very many for schools. Right now, we're trying to do this in schools where we see the community rates are high, like in Barrhaven, where there's just been so many elementary schools. We're starting. It's possible, but we're limited by supply. Holiday access has been discussed for the general public. Not high numbers of doses. So I guess maximize the channels you have through the Ottawa Board of Trade. And know that they will not pick up every piece of COVID, so you can't rely on them. Like you need the other measures as well. And they sometimes are a positive, that's a false positive, so it needs to be confirmed usually with PCR testing. But this is part of the program. I think people can understand that and implement that way. So in a limited supply environment, they would be prioritized for hospitals and long-term care, where people are most vulnerable. So, I don't have any more inside information about what's coming, except at a high level, more will come. So, we have heard the federal government is going to buy more, lots more. It's just this week, we don't have them.
Thank you.
Dr. Wilson, did you want to say anything more about the science?
Yeah, there's been a bit of controversy about how useful these tests are, but if you compare them for any COVID illness, they aren't as good as the PCR test. But for identifying infectious people, which is what we're trying to do here, they're actually quite good. And I think they're moving forward, when we do have more tests, they're going to be really valuable pieces of our armament. So, I think as a business, I would consider at least conceptualizing how you will incorporate them when these tests become available. Until we get 3 doses into everyone, we have to consider people vulnerable.
And I would just say, Lynn, to let everyone know that our demand has more than tripled in the last couple of weeks. I was on a call this morning with the Ontario Chamber, as well as a representative from the Ontario government. This is a case across the board. I think because of the unknowns with the new variant, as well as people looking for more strategies, there has been a huge demand, and there are supply challenges, and we have supply challenges through our organization as well. So we are trying to be thoughtful about our distribution over the next couple of weeks, with the anticipation that there'll be more for strategies in the new year. Okay, Lynn?
Thank you. Next question, and it could go to either Dr. Etches or Dr. Wilson. How at risk are unvaccinated children under the age of 5 with Omicron?
Sure, I can start again and absolutely appreciate support. The question of how at risk, it does depend on what you're talking about. If we're talking about at risk for infection, it's high. They're an unvaccinated population. In fact, children 5 to 11 also, the risk of COVID infection is high right now in our community compared to all the other age groups. The growth has been exponential in the 5 to 11-year-old group. So 1 dose of vaccination, which thankfully, thanks to those on this call who've got their children vaccinated, half of children in Ottawa have had 1 dose, but it's not sufficient protection. It's the start of their protection. It takes 2 weeks after that first dose for their immune system to respond. We need the second dose, which at this point it's 8 weeks in the future, and then some time after that. So I know people seem frustrated because this was like, oh, we've done everything, we've gotten our kids vaccinated. It will help, just not yet. We'll get there. That will make a difference for them, because we can see the difference right now in secondary school students. We have 1 or 2 outbreaks in secondary schools compared to 35 in elementary schools, right? It's very different. But if the question is, are they at risk for hospitalization? Are they at risk for severe illness, even death? Very, very little risk. The children can handle this virus very well. And so the challenge is growth in the quantity of the virus in any age group spills over into other populations and helps, helps seems a funny word to use, it makes it harder to protect more vulnerable older adults. So the transmission is important to decrease in the under 12, under 5s. And there are unknowns, right? Just still lots of unknowns, long COVID, we don't know how many children, we're still learning. So if we can prevent the infections, that is the best way to keep children healthy. And in school as well. They need to be able to stay in school for their health too.
Dr. Wilson, did you want to add anything to that?
No, I thought that was really well described. I think that there are two issues here: serious illness, which is a reduced risk, but not totally zero. And there is the risk of infection and population spread and spread to older adults. And the one thing we do need to keep in mind as we're going into the holiday season is some of these children may come into contact with, grandparents, and we want to keep them safe. So it's just something we should all be aware of.
Thank you. The next comment is more of a comment than a question, but if anyone would like to jump in and respond, I invite you to do that. Dave has mentioned we have a large retail business dealing with thousands of customers weekly. We have required proof of vaccination for new hires and existing staff. This would seem a reasonable layer of protection in addition to distancing, sanitizing, mask use. We are continuing to award new staff with the vaccination bonus we provided earlier in the new year. I don't know if anyone would like to comment on that, but I do think that's a great idea.
Yeah, I just want to applaud Dave actually for taking that step and putting those policies in place. Certainly, no doubt they've increased the vaccination coverage amongst their teams by doing so. So it's great to see.
Thank you.
I think it speaks to what Colleen shared too, that there are things businesses can be doing proactively to increase their layers of protection for their employees, but also for their operations in general.
Excellent, thank you. Now we have several questions from a single guest. The first is, would placing unvaccinated people on unpaid leave generate the same risks with regards to employment law challenging as a termination? So I'll leave that with Colleen.
Sure, and Brian, if you want to jump in, but yes, I would imagine so, because it's, we're obviously without an income, maybe even in a worse situation because you wouldn't be receiving severance pay. So I think to all intents and purposes, it would amount to the same thing. But again, it depends on the context of the employment situation, whether or not you are able, or whether or not you're permitted to do that, right? Or whether or not someone would be able to successfully grieve this. And as I said, there's a difference between unionized and non-unionized environments. In a non-unionized environment, you can terminate someone who's unvaccinated, but the reasonableness of that termination may go to whether or not you have to pay severance pay. Do you want to add anything, Brian?
So the second question, same guest, what is a reasonable time period to require proof of vaccination before placing someone on unpaid leave?
Well, I think that's more of a medical question than a legal question, because again, the reasonableness of what you do needs to be based in science and evidence and so forth. And again, as I said, I think the reasonableness of what you do, if you can show that you've made efforts to help people get vaccinated, that you've facilitated this, that you've encouraged it, that would all speak to this. So I think, I don't have a number, but again, it would, if there are significant risks because of the environment that you're working in, with a lot of vulnerable people, for example, then a much shorter time frame would be required. I don't know, do you want to add anything to that, Brian or Kumanen? What do you think would be a reasonable period?
Yeah, I don't have a number either. I haven't seen any discussion of that in the cases, in the few arbitration cases. It occurs to me, I mean, you could have also combined policies of saying, you've got this much time and you're on unpaid leave after that time until you get vaccinated. So they're combined measures here.
Yeah, and to Colleen's point, I think the answer to that question has just changed with Omicron. I think we had a bit of a buffer period with Delta, but as we're going into pretty steep exponential growth, I think the tolerance for delays and proof of vaccination is much less, and I think it may be very short time periods now.
Yeah. So that's the trouble, right? Our analysis is always having to catch up with the science of the disease and vaccination science, which is evolving constantly. Sorry, Alicia, I spoke over you.
No worries. Every organization also needs to think about the geography and availability of vaccine product when they think about this time. So as you're moving towards, booster doses being required, you're going to have to make sure that there's ample time to get it before you put those kinds of requirements in place. And I think, we heard this from companies, in late fall, they were able to put these in place with short timelines because by late fall, everyone had ample time to get 2 doses. I think we're going to have to think similarly when it comes to booster doses as well.
Thank you, everyone. We're getting very close to our time for today's webinar, so I'm going to try and get through these last 3 remaining questions as quickly as possible. Su-Ling, I think this question could be directed to you, but I think some of our other guests might want to weigh in. Can the Chamber consider creating a repository of sample vaccine policies so we aren't starting from scratch?
I think the short answer to that is yes. Mm-hmm.
Thank you.
And we have access to that kind of information through the Ontario Chamber as well. So that's something that we can work on over the next few weeks.
And there is some guidance right now for businesses on the Ottawa Public Health website as well.
Yes, thank you, Vera. I forgot about that, sorry. So it's done. But if there are other specific industry ones that we need, then we can access that. Sorry, Colleen, go ahead.
Oh, I was just going to say, I think it would be terrific to provide that kind of support and for industries that have similar kind of risk profiles, right, to sort of somehow crowdsource the needed legal advice, because individually this is very expensive for companies to have to get. Yep. And and I think if you're just casting around online, you'd be horribly confused because everyone's going different ways. Mm-hmm. So I think that would be really helpful if it was possible.
I think that's a good point. There's a trust level if we're accessing it from businesses we know. Very good. Lynn?
Thank you. I can answer the next question from Dave. He wanted to know if this presentation is going to be available after the fact, and the answer is yes, we are recording. As soon as I can, I will get it on our YouTube channel and our website, and all of our registered guests will be sent the link when it's ready for viewing. And our final question for today, how do we handle our employees having to go into other workplaces where they are not requiring their employees to be vaccinated? What options do we have to protect our staff? And I'll let anyone jump in and answer that.
I mean, I can start. There's stuff we do know that does work. Obviously, they need to be vaccinated and get a 3rd dose. That'll protect them. They should be wearing masks when they go into those environments. They should ideally have some kind of ventilation in those environments to further, reduce the risk to the individual. And, when rapid antigen testing becomes more widely available, this can be something else that can be provided for those individuals to ensure that they remain safe and protect the other workplace they re-enter into.
I think also learning about the time, especially if you're repeatedly going into these environments, think about how you can change your operation to lower the risk exposure to your staff. So if it's picking up linens, for example, is one of the companies that we work with, they change how they pick them up. So not having to go inside if they know it's an unvaccinated workplace. So I think those are some of the options available as well. Just think about how you might be able to do things differently to reduce risk.
Is there any reason too that you couldn't ask those other businesses what their own policies are?
No.
Mm-hmm.
Of course you could.
Okay.
I can tell you no, but
right.
You can still
ask.
You
can ask.
and I think that that's important. I think the thing to remember, is that while there is some risk to the person going in, if he or she is properly vaccinated, masked, etc., it's actually more risk to the unvaccinated folks in wherever they're going. Yeah. But that doesn't negate, I think, Alicia's idea of, thinking outside the box. We've all had to really do that on the fly. backwards and high
I
heels.
think we all have a master's degree in thinking outside the box at this stage. So with that, Lynn, I think we should wrap up. We're just over time. I want to say thank you again to Dr. Etches, Dr. Wilson, to Alicia, Colleen, and Brian for being here, doing it on short notice. And I think the message here is that we need to continue to exercise the muscle that we have developed over the last 22 months in terms of being thoughtful about our behaviors and our attitudes, frankly, making sure that we're getting our boosters that we are and that we're using, and our vaccines, of course, for those who still haven't received those, and using every tool possible in order to strengthen the many layers of protection that we can. So whether that's rapid testing, masking, distancing, limiting our exposures, that's what we need to do so we can get through this next phase and continue to be hopeful for the future when we can all get back together in a way that we are familiar with, but leveraging the things that we've learned in the collaborations that we have developed. So thank you again, all of you. Happy holidays, and we look forward to seeing you again soon. Thank you.